Welcome to the Essential Pelvic Health Podcast. I'm Laura Rowan, your host, and I am here with my inspiring pelvic health occupational therapist colleague, Sujata Martin. And we're going to be talking about somatic techniques to address trauma during pregnancy, fetal positioning, and integrative pelvic care. So, Sujata, welcome. Thank you for
Thank
joining us.
you. Thank you. Thank you. It's so exciting to be here. I love collaborating with all kinds of professionals, but specifically occupational therapists who are working in this wonderful and rewarding field of pelvic health. And I'm so inspired with all that you have done to move this field forward, Laura. So thank you for the work you have done and thank you for inviting me on. I am
Yeah.
so happy to be here.
Yes, likewise. And the feeling is mutual because I feel like we speak the same language when we talk, when we like interact, like in social media and all the pelvic health groups,
Yes.
everything that like we are
Mhm.
doing is resonating.
Yeah.
And you started in Buffalo, which is a bummer because we were
Yes.
so
I
close and we didn't get
know.
to connect then. But
Yes, yes,
um, now you're in Tampa,
yes.
and your practice is Pelvic Soul. I love that
Mhm,
name as
mhm.
well.
Thank you.
But I really love I really enjoy our conversations where we get to connect about the different mind-body approaches. And I'm really touched and learned so much from your spirituality that you bring into
Thank
your
you.
practice.
Thank you.
Um, and and you also treat all genders. So that's
Mhm,
kind of near and dear, and to be able to have a nice comprehensive
mhm.
approach and just like parallel practices, it feels like.
For
Yeah.
sure.
Yeah, yeah.
Yes.
And you also, but in addition, to being a pelvic health OT, you're also a yoga instructor. You
Mhm,
are also a birth doula.
mhm,
You are a sex counselor, which a lot of times can be incorporated into pelvic health, but not
mhm,
necessarily.
mhm. Yes.
And osteopathic work. Yeah.
Yes, yes, yeah. So this is almost like the resume of like a classic ADHD brain, right? Like, yes, oh yes, I do that. And oh yes, I do that.
All right.
And which is why I thought we need a term that explains this kind of, and a lot of us, right? Pelvic health practitioners have this ADHD brain and we are like so hungry for knowledge because it is a nascent field. Like even with like research and new techniques, this field is growing. So, us practitioners who want to give that best level of service, we are learning and incorporating this, we are learning and incorporating that. We are kind of giving this multimodal approach of treatment, which is why I came up with we need a better term for this work, which is where integrative pelvic care comes from. That yes, we are going to use some yoga based work, yes, we are going to use some doula and midwifery based knowledge, yes, we are going to use straight and hard evidence based pelvic rehab, and yes, we will use the wonderful hands on manipulation techniques from osteopathy. And that is what we want to deliver, in this umbrella that we are calling integrative pelvic care. So yes, yes to all of that.
Yeah. And exactly it, like the integrative is it's being able to follow, you learn something, you get excited about it, and then you apply it, you process, and then like my clients lead me in the directions of like my new
Yes.
learning. There's always something new to learn. And I think where we really connect well is that mind body, somatic, nervous system integration. So we're going to
Yeah.
talk about that. Anything
Yes,
else that you want to
definitely.
add as far as kind of your background? You were an author. You wrote not just Kegels.
Yes, I know. Yes, it's so funny. And the funniest story was sometimes, like, I am like a lot of us, we are so mission driven, right? We don't do this work for the financial bottom line, for, how much I build. We do it because I love it. I remember actually, I was just randomly scrolling Facebook while like feeding my little one, and I get a text from another OT, and she's like, "Hey, is this book yours?" I saw it on my Amazon Kindle list, and I was just like, "Oh, wait a minute." So that's something, yes, I had put out on the beginning of my career, not just Kegels, with like zero marketing, zero nothing. It was just, I ran into the problem where I'm an out of network practitioner and I would get clients who truly could not afford it, could not afford to work with me. And then I was just like, okay, what can I do to serve this person who wants to work with me at some level? And that's where that ebook came. So yeah, even today, to this date, it is available for like 899 on like the Kindle app. And it's very easy way to get like basic pelvic floor and core knowledge and activation information, like basic prenatal exercise breath routine going. So yeah, and in launch week, I think that's how it had popped up on that OT's app. In launch week we were like number 2 on the pregnancy and childbirth list, which was amazing. So
Awesome.
yes, very exciting.
Yeah. And it's, like I love that you kind of highlight that we need to be able to get information out there in all different levels, right? To make it accessible to people. So
Mhm. For
awesome.
sure. Definitely, definitely.
Okay, so we're going to talk a little bit about some somatic techniques to address trauma in your pregnant clients, right? So, and again, this podcast is for individuals looking for information. So, if you're pregnant and you want this information, or if you're a medical or wellness professional who's serving pregnant clients, so let's talk a little bit about just defining what somatic techniques mean.
Definitely. I will start by saying that terms like somatics or integrative care or even mindfulness have become like so jargony these days, that and so popular in a way. In a way, I'm so happy. Like, yes, we are talking about this stuff, but also in a way because everyone's talking about it from the client end or from the curious professional end. We think these concepts are like fluff, like they are not important, they are not evidence based. So if anything, if a listener takes anything away from this podcast episode, it is that this is not so fluffy, this is not woo woo, this is as evidence based as it can get. We are just looking like the knowledge we'll be sharing today in this podcast and through the educational company I teach through, Integrative Somatic Healing Institute. We share references to evidence published in the Western world in English, and we will give citations to texts that have existed in the parallel system of medicine of Ayurveda, which is a lot of people are not familiar with. Most of us are familiar with acupuncture and traditional Chinese medicine. So, to give a little background on that, Laura, I know I'm taking like the long scenic route to your
Do it.
question.
Do it. That's what we want to hear.
Um, so most of us are familiar with traditional Chinese medicine and acupuncture. Ayurveda is traditional Indian medicine, so very parallel in philosophy. And both systems of medicine, traditional Chinese and traditional Indian, believe that the mind and the body are not separate. It is one system. If yes, so when you treat dysfunction, that is how one is treated. Meaning, if someone goes in with a mental health condition, they will start with physical therapies because the physical body, the tangible body, is the easiest step in to addressing that cognitive portion, that mental health portion. And funnily enough, OTs knew that. Like, where did OT come from, right? We were
Mental
addressing
health.
physical
Yeah.
dysfunction. Exactly. We were addressing mental health conditions like depression, PTSD through that physical modality. So, somatics is not new. Somatics has been touched upon in so many different professions. Like, there were psychoanalysts. So when we look at Western medicine-based references, we find the work of Freud and Kahn and like other psychoanalysts and psychiatrists in the Western system. We find Ayurvedic-based scholars and experts who have been writing from like 5 or 600, not even five, like 600 to 800 years back. But they are teaching us how to address a mind that is overactive and working too fast, or a mind that is depressed and moving too slow. It's just that what happens is things get lost in translation. Like a Chinese medicine practitioner may say, or a Ayurvedic practitioner may say, you have too much dampness in your body. To me, I see that clinically as you have lymphatic congestion. And that is exactly, if you palpate them, you will find the lymphatic congestion if you are a trained therapist who knows how to address lymphedema. So sometimes, because we don't speak the language as the experts in the systems of medicine, we think it is not a science. So that is what I want people to take away, that somatics is not like woo woo, is not fluff, it's not like the latest Instagram trend. This is that mind body work has been existing for centuries in other parts of the world. And there were like MDs, doctors in the US, in Europe, in the early 1900s, who were doing this. Like even like for so many parallels we can see where conditions were, for example, like people having physical ulcers. Like now, research will show that physical, like stress ulcers in the gastric area, like stomach ulcers, occur in people who are having anxiety or stress or high stress personalities. So we recognize, even in the most cut and dry setting, like even if you are steeped in the Western medicine model, not open to anything integrative at all, if you have cardiac condition, your doctor will say go do yoga or do mindfulness, because now Western medicine is accepting, yes, even for something as simple or as physical as a clogged coronary artery, mindfulness can help you. So there is that connection being made. I want professionals in the rehab world to have a language to use with their clients, with other professionals, where they can tap into that mind body intervention piece without sounding like they're doing something fluffy, or woo woo, or this is no longer a science, which is not true.
Yeah, and like you said, it is a science, and we've
Yes.
really been able to understand. Like before, it may have seemed woohoo because we didn't understand the science behind it. We couldn't explain
Exactly.
it. Now we really do have the science behind it to be able to. I think the book Breath by James Nestor, he like describes it as
Yes.
the
Yes.
lost a new art of a lost science or something along those.
Yes.
But
Yes.
it's
Yes.
basically this. We know that breath work has been around for centuries and it
Yes.
has profound
Mm-hmm.
effects. We just didn't
Oh,
understand why. So it never made it into like the medical model, right? So you talk about
exactly.
Eastern versus Western medicine,
Mm-hmm. Mm-hmm.
medical models,
Mm-hmm.
and language, right? Like, so there may be meridians or lines
Yes.
that an acupuncturist is going to be working on, and that can translate and make sense in a more myofascial sense, right?
A
But
hundred percent.
we can all connect them, and that nervous
Yes.
system
A hundred
is
percent.
is that brilliant connector of what
Yes.
happens emotionally and
Yes.
mentally and
Mm-hmm.
how that manifests in the body and vice versa,
Yes,
right? So,
exactly,
yeah.
exactly. So with somatics and with the somatic approaches, I want practitioners to have this framework, because that when I say it's a science, I want to back it up, right? So science is something that is based on evidence that has been proven to work, that is reproducible, meaning it's not just like, oh, Sujata has magic hands, she can do this. No, no. If you follow these steps, if you follow this framework, you can get very, very similar results, because it is reproducible, it's replicable. Like we talk in research, it has iterator reliability. Like, that is there. It is not that, again, this person is intuitive or very skilled, which, sure, I will not say I'm not, but it is a scientific framework. So going into somatic
I
technique.
want to touch on that just a little bit too, because that's a brilliant point. When I started out as a therapist, I didn't really use my hands at all. And I started taking some shoulder courses and started being able to like understand that I could therapeutically
Mm-hmm,
use my hands beyond just like manual muscle testing and range of motion.
mm-hmm, mm-hmm,
And then, but I always felt like, oh, I'm not an intuitive therapist. Like
mm-hmm.
I just figured certain people have that sense, right?
Yeah.
And what I discovered was the more that I just applied the practices, I built that skill. It's a skill that you can
Yes,
build to learn how to listen with your hands, how to
exactly.
communicate with the nervous system and the brain through your
Yes.
touch,
Mm-hmm.
and then you really
Yes.
do own that, and it does
Right.
feel a little woo-woo or intuitive, but
Yes,
it's a
yes.
skill like anything. You have to
Mm-hmm.
apply it. Like in Pramat, in
Yes.
my intro pelvic rehab course, we learn how to just use our hands to communicate and just start from the basics.
Yes.
And then
Mhm.
that's how you get your, I would say you get your reps in, and then you build
Yes,
that. Yeah.
exactly. And that's what I tell. So right now I have worked with three clinicians, two PTs and an OT who have worked in my practice. And I was trying to like teach them this technique. We are actually, and Laura, I'm sharing this because you gave me permission. Next weekend, we will be doing our first in-person cohort where I act, and funnily enough, I have only PTs and a chiropractor in this enrollment, hoping to have more occupational therapists and other professionals attending. But that is something I share very openly. Like in the beginning, you may even feel like I don't know what I'm doing. So trust the framework. Put your hands on these anatomical landmarks. Guide your clients as we tell you in the framework. We start with just, and that is the beauty of the yoga based energetics. That's where the somatic work is coming from. So people ask me, oh, are you doing Reiki, or are you a medium? Like, no, none of that. Nothing against it. Like, that's just not me. I don't have any Reiki training. I don't believe I can talk to souls passed on. Um, Yoga is a science and there is a framework. And just like in traditional, like the basic understanding of the human brain from a Western psychiatric standpoint of conscious, subconscious, unconscious, that's how the cognitive or the thought patterns are looked at. Yoga does like a five system or a five layered sense of self. Like the human body, they call it the human system. Really, it's not a body, because body just makes us think physical.
Mhm.
So Ayurveda and yoga say that every individual is a system, and to be in good health you have to be in balance with the environment. So if someone is in dysfunction, like if someone comes to me as a practitioner and says I have this illness, there is a imbalance in the internal system, or in the internal work and the system, the environment they are in, so the external system. And that is why, again, we know this, right? When work gets stressful, we take a vacation, we remove ourselves from that external environment, and the internal environment starts settling. So a lot of us intuitively do these things. But that is what Ayurveda is saying, is that this is not just your gut telling you what to do. This makes sense. Like we are symbiotic beings, like we as humans are in our best health and dysfunction free when we feel in balance with our external environment. And if we are in a state of illness or dysfunction, then it is up to the practitioner to recognize where is the imbalance. Is the imbalance internal or external, and help them find that place of just right, using some OT speak. So there, in that internal system, coming to the somatics, how we look at it is, okay, is the dysfunction in the individual's physical body? Is this a joint restriction? Is it muscle? Is it fascia? What is happening there? Is there something going on biochemically in hormones? So again, Ayurveda is not just take some, well, herbs, herbal medicine, where they alter your hormonal levels, is a big part of in traditional Indian medicine and Ayurveda. So is that dysfunction, that imbalance in your physical body? Then there is the concept of the energetic body. And again, when I even say that, it sounds like, oh, woo woo. But even in English, we say, right, oh, I feel butterflies in my tummy. Or when we are nervous, like, oh, you feel pins and needles. Or like that is us in our common speak referring to energy, or she sucks the energy out of the room. Like people literally use language like that. So even those of us, or even those among just general population who are very much in that medical model, we use language like this, like I could feel it in my gut. That is us saying that our conscious brain is registering an input from somewhere deeper. So again, like if you do take the course, you will get the citations in terms of which text, which verse, which section of the text, where this is gone into. Like we go into the physical body, under which lies the energetic body. That is that sensation. So a lot of the needling that acupuncturists do is working with that energetic layer.
Mhm.
Also correlates with fascia, which is honestly where my intro to this world came. Is I'm a very, very strong manual therapist. I love manual therapy, and I would do fascial work, and I've had someone start trembling so hard they almost fell off my treatment table. Like they're just full body and they had no history of epilepsy, nothing like that, nothing in their history. And in the beginning, that had happened early in my career as an integrative pelvic health therapist, and it threw me off. I was just like, and I thought, like, foolishly, what did I do? That's
Yep.
what I was
Yep.
thinking. Like, what did I do?
Yeah.
Because it was not a good input. And as an occupational therapist, we work from a place of safety, we work from a place of regulation. And that's what got me started into studying this more. And now, from a yogic perspective, I understand I had gone beyond physical treatment to that second layer of treatment. And while that person's fascia was releasing, they were having that energetic release simultaneously. So there are ways, and this is also something we teach clients. Oh, sorry, when we teach clients, yes, but I teach practitioners This is how now you bring that energetic release to happen in a grounded and safe way.
Yes.
So it doesn't like throw off the client and it's not too much for the system, right? Because again, if I'm drawing from yoga and Ayurveda, I want the system to be in balance. I don't want to like rattle the system.
Right. It'd be too dysregulating. Um, and
Exactly.
that tremor, I had a similar situation where a client, she looked at me and she goes, "Oh, are you familiar with a tremor?" And I was thinking about like tremors,
Mhm,
resting
mhm,
tremors, intentional
mhm,
tremors, of
mhm.
course. And she went into a full body tremor.
Wow.
She's a practice. She actually taught me how to work with the nervous system
I
tremor. And
love
the concept
that.
that our nervous system has a tremor to process trauma and stress and anxiety. Like if you're
Yes,
in an
yes,
accident and you tremble, or our dogs get dysregulated, they get fearful,
exactly. They
they
shut
tremor.
off. Yes,
And
yes,
it's a positive way, but we get so used to kind of stunting that and holding that
yes,
back.
yes.
That like now she was able to train me to be able to help
Oh,
guide my clients to elicit that tremor in a safe way.
wonderful. Yeah.
And it can be a little scary, be like, is this a seizure? No, it's not.
Yes. Mm-hmm.
And to be able to process and release that. A lot of it is processing and releasing and understanding. You mentioned consciousness versus subconsciousness. A lot of
Yes.
these things, drives and physical symptoms or responses are coming from these subconscious protective
Yes.
responses. So being able to
Yes.
get
Yes.
underneath what those are for the true
Def-
healing.
Definitely. So I will say in again the education I put out in the coursework I teach, I try and draw parallels as best as possible because exactly what that client told you, Laura, that is how a lot of Western experts speak, right? That is the language you are using, and there is very similar language in Ayurveda and yoga. So again, kind of no matter which system of medicine you are using, there are parallels and we are saying the same thing, just using
Yes.
slightly different phrases and yeah, language. So going into somatics for pregnancy, I think it is very essential to understand how yoga and Ayurveda look at the human being. So again, in modern like Western medicine, we just talk mind body, but that is then two things, right? Two parts of a system.
One word, right? Put the words together.
Yes, yes, but it's still two. So
Mhm.
depending on the tradition in yoga, the one I'm using, there are five layers. It's not just one. It's not just two, not even just mind and body. So
Yeah,
there is the physical body, then there is the energetic body. Then there is the cognitive, like your thoughts, like things you're actually thinking. Then there is your
thinking.
emotion or the gut feeling, because that's a deeper layer, right? For example, like people who experience PTSD, for instance, they don't actually think a bomb went off when they hear fireworks, but a part of their gut which is deeper under that conscious mind is triggering that, oh, that's something like a shelling that happened when they were in active duty over in the Middle East, you know
Yeah, like an
and then
association protective response.
yes, yes. And then the fifth step or the fifth layer would be that deepest felt sense of this is my soul. Also, yeah, the thing to understand about this five layer system of the human body is that it's not like nesting Russian dolls where one layer is under the other. It
Mhm.
is like they intermingle and intersperse. So again, these scholars had moved so far ahead in their medicine that they recognized that when you do, your energy, your emotions are in your bicep, like you carry a memory there. Like things again, Western scientists are proving like there are neurons in your gut, like you can think from your gut. Your serotonin, how you feel, is in your gut. This is something we are proving now through Western medicine based research. But this is what the system is saying, that these levels intermingle and communicate. So if as practitioners we want to bring someone to like full healing, it really helps if we understand those multiple layers and then help our client go from that physical muscle fascia level to deeper and see what lies there. And okay, now in your thoughts, what lies there? Okay, let's go deeper into your intuition and gut and what lies there. And you
Yeah.
go deeper and you don't have to ask, like they will know and they'll speak and they'll tell you.
Yep.
And that is how we integrate or close the loop on healing.
Yeah. And that's so two things there. So one, going back to your course that where you basically help teach people how to do this.
Yes.
We're gonna get this podcast out quick because it's next weekend, right?
I
So,
know.
so
Yes.
hopefully we can get the word out and people can hear about it. And then again, like, just kind of hearing you talk about building the awareness, like, understanding that the body's communicating with us, but we just don't understand it, right? So we
Yes.
got to be able to speak its language, understand what's happening,
Mhm.
interrupt some of those subconscious patterns that aren't really serving
Yes.
us, and then
Exactly.
get underneath it and figure out, well, where did they come from
Yes.
originally? Where was that developmental nervous system dysregulation, and
For sure.
how can we repair that and heal that?
Yes, and I will say I also love occupational therapy and the work we do because some of these concepts I see in the body of work from OT in the terms of interoception. In a
Yeah.
way, interoception is that person's awareness of that deeper layer,
Mhm.
right? So there are again so many bridges that exist that we don't even know are there, and that's what I'm hoping to like introduce people to, like, hey, look, this is you're already doing it. You just need the language to communicate to your client and to other professionals, so you don't sound like you are like waving incense and doing something like woo woo, as people say.
And so thinking about trauma. So I
Yes.
think sometimes people think of trauma as like the big T trauma.
Yes.
Um, and yes, we work with a lot of that, but we
Mhm.
also work, and sometimes we don't even allow ourselves to own that
Yes.
there's lots of different more subtle traumas,
Yes.
just even like a birth plan not going to plan or
Oh, for
C-section.
sure.
Like sometimes we put a lot of shame on ourselves for not
Yes.
having a vaginal delivery. And even though
Yes.
everyone's safe and healthy,
Mhm. Mhm.
we have a lot of those kind of emotional
Yes.
hang-ups, for lack of a better word. Um,
Mhm.
and so tell us a little bit about how you kind of work through that, or like what are some common things that you see and help people work through?
Sure, because and just like you said, Laura, trauma is so individual. Like two individuals can have this exact same experience, but their perception of that can be so different, right? So trauma doesn't lie in the event, trauma lies in your perception of the event. What did all those layers of yourself, your energetic self, your gut self, your thinking self, like what did your soul feel and interpret from that event? So, as far as treating trauma, I now do this work very frequently. It's a big part of my caseload. In my community, other professionals like referring parties recognize that, okay, this is a practitioner. So I see a lot. I see everything from people who have eating disorders, have had body image issues, and they literally will have fascial tension around their throat and their voice box from throwing up, like from bulimic behavior, from restricting food, and that will present as chronic neck pain. So
Mm,
now I know when I feel and I assess from a completely physical standpoint also. This client would tell me, I have seen every PT, every acupuncturist. I do EMDR, but my neck pain will not go away. I get Botox every 3 months, it barely helps. And that's when you know this person has addressed a bunch of things from the physical perspective. They did do some EMDR, which is great. They were starting to peel away at that subconscious, unconscious layer, but their physical pain was not improving. So that kind of client is honestly like one of the ones that benefits so much immensely from this work, is where they have only tried physical modalities and they haven't been able to move past their pain, their sexual concerns. They feel like I am not interested in intimacy at all, or they are stuck in cycles of not feeling so great about themselves. So that would be a client that would benefit. I had someone who was, again, small t trauma, something as much, and her, well, again, relative, right? So her small t trauma was being a single mom and having to raise a child on her own while again doing school and working two jobs. And she would say, like electric sensation kind of pain under one of her shoulder blades on her right side. And same story, she had done every physical modality, and her trauma was literally almost like carrying the weight of the world on her shoulders. So just understanding that oftentimes these emotional and even spiritual, not an attack but spiritual hurt. Like I work with people who were very deeply hurt by the faith system they grew in, and this is, I think, a lot of us will relate as pelvic health therapists. There is such a overlap between people with those deeply held beliefs about like shame and negative association based and their pelvic health. So that will be a lot of overlap. So really, it is anywhere that we find a dysfunction persisting despite conventional treatment, then you know that client is great for integrative care, because most modalities accessible to people in the Western world here are that physical modalities. And you, as a practitioner who's open to these integrative modalities, will be able to further their healing process.
Yeah.
I hope that
I
answers
had
the question.
Yeah, no, you just, when you were talking, it made me think of a client that I had. And I remember first off the bat, he was like, okay, I'm here to work with my GI issues. I don't want to get into my childhood. Like he had tried that and it was too intense. And he was like, I
Yes.
just want to fix this without having to go
Mhm.
there. And I was like, well, we're
Yes.
gonna start where you feel safe.
Yes.
And eventually it has to go back there because that's
So,
the driver, right? And
yes.
but we were able to do it in a way that felt safe and he was able
Mhm.
to embrace that and feel comfortable doing it. So, and we had
Yes.
really good
Yes.
success and outcomes. So,
That's awesome. I love that this client was even open to trying that, because you will even get people not even as a trauma response, and maybe it's a trauma response, but some people who are just so like square, like they are very happily in their box.
Mhm.
They don't want to look outside the box at all. So even with that client, so again, that's another thing I have gained a reputation for. Oh, this person treats pelvic pain very well, because again, sometimes this I am thinking of a specific male client accountant. He was actually a partner of a very big accounting firm here in my city, and multiple pain management specialists, multiple shots. They were looking at now like a spinal block, but he had tried two other practices and not gotten anywhere. And he was not open to anything. Even like breathing was just so hard for this person to do. So sometimes we don't even have to get a client who wants to do the deeper level of healing. But you, as a practitioner, can bring, okay, just inhale into your belly, inhale, inhale, inhale. Now close your eyes for me and just feel that tissue expand. So what we are doing is we are improving interoception from, again, Western medicine speak. From Eastern medicine speak, we are tapping him into his energy or breath body. We are getting him one layer deeper. We moved him right now from the physical. So I didn't just say, did your belly expand? I'm saying, oh, go into your inner eye, go into your inner mind, and now feel that tissue open up. So imagine then, and you use language that works for that individual. This person had pelvic pain, bladder spasm, bladder urgency, and yes, if he does that fascial opening that he's visualizing with the breath, and I assist with my hands-on manual therapy, he will get there faster versus us using our hands and trying to get there to a position of fascial release. So
Right.
even from
Doing two.
Exactly.
Yeah.
So even if you just stop at the breath level, the energy level, that's fine. And that's actually where this started, because I am a hypermobile person. I don't have my braces now, but I treat with braces because we do so much manual therapy, right, as pelvic health professionals. I began getting carpal tunnel pain, getting tendonitis, and I love this work so much. I had to find a way to adapt technique
Yep.
to access the tissue. So I was like, okay,
Sometimes we have to OT ourselves.
yes, exactly. So I was like, okay, I'm going to use the same hold, but I'm going to make the person use their breath to add the tissue stretch. Because mechanically, what is happening is the tissue is stretching, the fascia is being loaded without me needing to use my hands as hard or with as much strain.
Yeah.
So even if we just stop there, just bring breath into your manual work, you will see better results. Not just from a mechanical perspective, but guess what happens when someone takes a deep breath? They start shifting into parasympathetic, right?
Yep.
We are, without even necessarily shooting for it, taking this person from a high alert, I'm hurting stage to rest, digest, restore. We are like getting that. So this individual, like he knows he should meditate, he knows he should do mindfulness, but that is just not in his,
Yeah.
life, right? But even just doing those couple deep breaths while I would do manual therapy on him, he would say, "Oh yeah," and that's how we got started him into doing some mindfulness and breath exercises. So it's like really tailoring into your client and knowing that you don't need to be this woo-woo person to benefit from this very systematic framework of achieving good results.
Yeah, and a lot of it, like you said, get them started somewhere, and just
Yes,
getting them curious. What comes up for you when this is
yes,
happening? And that subconscious will bubble those, it'll throw those things forward, and then it starts to flow, and then they start to make those
exactly.
connections, and then the processing happens.
For
It's
sure.
magical,
Yes,
beautiful.
yes. Yes, so just closing off as far as somatic work with trauma and pregnancy, that is, so integrative pelvic care is this whole system of providing pelvic care for multiple diagnoses through the lifespan, right? We are starting with pregnancy. It's an easy place to access because it does tend to be a little superficial layer of work, meaning we don't do deep trauma exploration and healing in pregnancy because that system is working too hard. Again, from the Ayurvedic point of view, this system, this mom's body is keeping a baby healthy. Like that system is already on overdrive. I don't want to make you process trauma while you're there.
Mm,
So I do agree, Laura, when you had mentioned how that person, your client, had said he doesn't want to go back to his childhood. Sometimes mental health therapists, while they are using evidence-based modalities, because they may not necessarily have the skills to keep someone in a state of regulation, it tends to be more dysregulating. I have
yeah,
seen so many clients who get turned off of therapy. I've had someone say, I don't want to have like one good therapy session and then drive around town crying for 3 hours.
yeah. Mhm.
Because this is a
Right.
male patient again. He was like, I didn't want to go home and like sob to my wife and kids. So he just literally drove around for 3 hours till he felt regulated enough to go back home. So sometimes, so again, what a gift to be pelvic health therapists where we can access this part of the body with affirming, supportive touch. And we can use this very systematic way of addressing the person's concern and just bringing them into regulation. I'm not even saying bring them into safety, bring them into healing. Those are higher level goals. Bring them into regulation, teaching them skills. You modify your breath to go from that state of hyperarousal to calm. And we like slow your breath down and slow your breath down and slow your breath down till you feel regulated with touch in that space. So we are starting off our training with our training series with pregnancy because we know we will not jump super deep, because I don't want to throw a pregnant mom off. That mom is already stressed enough, both mentally, emotionally. Is the nursery done? Will I come after my due date? Will I be induced? So yeah, with pregnancy, we start with very specific gentle touch, with breath, bringing people into conscious awareness. And for a lot of people, especially who have done this kind of mind body work, who have done therapy, sometimes they will process past traumatic births, pregnancy loss, miscarriage. And for a lot of people with birth trauma, when they are pregnant, like we don't want them bringing that experience in to the labor and birth experience,
Mhm.
right? Because as pelvic health therapists, we know that negative emotions, high stress emotionally, high stress situation emotionally will cause increased muscle tension. So for that goal, for that mom's goal of vaginal birth with as minimal disruptions to the pelvic floor as possible, her being emotionally balanced and grounded is going to help. So, us using this very systematic work of bringing her into regulations with her emotions is so helpful.
Yeah. And kind of like you said, being able to have strategies to do that. Not that we're going to
Exactly.
keep you in a perfectly
Yes.
grounded level,
Yes.
but
Yes.
we expect you're going to get dysregulated. And when your
Exactly.
nervous system shifts, nervous system state shifts, being able to have tolerance for that, be okay with
Mhm.
that, and have strategies to
Yes.
get regulated
Exactly.
in a more responsive way, right? Rather than
Exactly.
stuck. Yeah.
Thank you. Because yes, most of us respond to dysregulation by tightening, like, and that's what in some other like Western-based somatics, they see the tremoring as a tendency to release and then go back into holding. Like, I want to let go, but no, I want to hold. Let go and hold, and that presents as the tremor. So yes, so I tell my pregnant clients, like, I love to talk about fears and trauma right now, because when your brain will check out, because your conscious brain is the gatekeeper, your forebrain. So right now, your forebrain is keeping that down, keeping a lid on it. But when you're in the thick of labor, the pain of the contractions will be so high that that conscious brain is going to say bye-bye,
Yep.
and anything in the subconscious and unconscious is going to pop out. And that's when people have very traumatic flashbacks, or they go into so much, like, because gripping or tightening is control. That's our system trying to control, that they tense up their pelvic floors, and then they are pushing for 2 hours or more, and they are straining their pelvic floor muscles, sustaining tears, increasing risk of prolapse, all of this thing. So again, having that conversation. So I would love for a day when addressing fear, and that is again a section in our birth preparation plan. So just like, doulas create birth prep plans with
Yeah.
their clients. Thank goodness for doulas. The
Yes.
world would be, yes, a
All
much,
the doulas.
yes, they're amazing, worth their weight in gold. But we as pelvic floor therapists have such a pivotal role in making sure the mom knows how to process the input from her perineum in a regulated way. Like, for people who have experienced trauma, sexual, emotional, like, even women sometimes get belittled for, oh, you have too high a libido, oh, you are frigid, or your vagina feels loose. It may not even be like a physical trauma or an injury. It could be emotional, it could be sexual. Maybe they are an assault survivor, maybe it's obstetric, maybe the GYN was too rough, with baby last time, or maybe they got an
Yeah.
episiotomy that they did not want. So when this person gets nervous system input from their perineum, I want them to be able to regulate. We don't want their system to go into fight or flight. Like, ugh. We want them to come back into regulation to allow that pelvic floor to expand and release baby as easily as possible. So that is the goal from this training that's upcoming.
Awesome. Awesome. And so it's called the Integrative Somatic Healing for Pregnancy, correct?
No, almost there.
No.
It's called Integrative Pelvic Care for Pregnancy.
Okay, thank you. And
Yes,
it's
of
July
course.
19th and 20th. It's in person in Tampa, Florida. You also are live streaming it, so you can join
Yes.
from wherever.
Yes, yes,
Okay.
yes, yes, we are. It would be amazing to have so we have pregnant models for our in-person participants. It's great if you have a pregnant friend who feels comfortable practicing on you, but if you don't, these techniques can be practiced on a non-pregnant person also. And
Okay.
very, very transferable to like real-time skills. Like, this course is set up in a way that you can take things you learn and start using it on Monday. So that is and I know, like, you do that too, right, Laura? You want people to walk away with things that they can start using in real time.
Yeah, absolutely. And how else can people get you? Like social
Oh,
media?
of course, of course. So my primary work has been through Pelvic Soul, which is my practice in Tampa, but I am shifting my professional focus to Integrative Somatic Healing Institute because, like I mentioned, I think there is such a need for this kind of healing in the pelvic area for professionals who have the license to touch in that space and get that deeper level of healing. So we are very unique as pelvic OTs and pelvic PTs to be able to provide that. So my focus now is the Integrative Somatic Healing Institute. I will share the links, Laura, that you can put in our caption below. And if you're looking for a handle on Instagram, it is at the rate of Integrative Somatic Healing. On YouTube, we are called Integrative Somatic Healing Institute. We have like a very nascent Facebook group where we are connecting practitioners, and we have massage therapists, we have doulas, midwives, we have acupuncturists in there, mental health therapists in there. So just a place for this curious professional who recognizes that right now, there is like a little gap in my knowledge. Like, I know there is something more I can do, but I don't know how to do it. right? And as an ethical professional, you don't want to just be like, I'm gonna like figure it out, like by myself. You
Yeah.
want like actual tools, you want a framework. So if you're an individual like that, come find us in the group and we share resources over there as well.
Amazing. Thank you so
Okay.
much, Sujata. And I can't wait to see what you have coming up next. I know you're always kind of on the upcoming, and I kind of can't help it myself either. Like, there's always so much like amazing, brilliant things to learn, and we're just kind of keep adding and growing, right?
Yes,
The growth
yes,
of
yes,
this
yes,
practice area and field.
definitely, definitely. Yeah. So to that end, like the pregnancy is like our first offering, and then we have a postpartum course scheduled as well as a fertility course, which I know a lot of people are excited for, because those folks who have trouble conceiving carry so much trauma. They carry so much within that that is the fertility course. Because I've got questions multiple from multiple people, is that it's scheduled in person, also with live streaming for spring 2026, and all of this in good stuff will be on our website soon with future training dates, so you can plan and enjoy the wonderful weather here in Florida, no matter where you are coming to us from or joining us virtually.
Amazing. Awesome. Thank you so much. Okay, and so a little after show conversation, we wanted to make sure that you guys also understood that in the upcoming course, Sujata is going to get into optimal fetal positioning, which I know like I've kind of heard like spinning babies, we can direct people to that kind of stuff, but I would love to hear a little bit more specifically what that entails and what work you're doing in that space.
Definitely. So spinning babies is Gail Tully's work. She's a midwife. So I totally understand that. So I get where she's coming from. Like it's a very biomechanical perspective. And it is based on the fact that if a baby is malaligned, then there are certain maneuvers you can do to improve alignment and get baby in a better position. So I, as you mentioned, Laura, I practice from an osteopathic perspective, where osteopathy, one of the foundational beliefs is that structure and function are interconnected. Meaning, if there is dysfunction, then there is misalignment in structure. So for a vaginal birth, it is optimal to have the baby in a head down position. I get clients who are even shooting a little higher. For like a shorter birth, there is evidence to show that babies should be in an LOA position. We'll go into that in the course, a little too much to talk about now. It just means left occiput anterior, like a way the baby should face, like baby should not be sunny side up. There's a way, even for a head down baby, there is an optimal position that allows for a shorter labor and lesser pushing. So, as pelvic health therapists, again, who have the license to treat this part of the body, we can do much more because some of those maneuvers are insane. Like, I don't know if you're familiar. There is a move where they want moms to be upside down on an ironing board, and I have had patients who had breech babies and they were like, I am doing the ironing board move like two every single day. Like, please leave the board. Let's try this instead. Because that is so much stress. Like, imagine that poor mom. I have to take time out of my day to lay upside down on an ironing board. It is the amount of stress that individual is under. So, anyhow, in our approach to optimal fetal positioning, we recognize where Gail Tully is coming from and where osteopathy says that yes, since there is dysfunction in that this baby is head up or transverse, there has to be some kind of structural misalignment. So through our manual skills, through the palpation and addressing the myofascia of the sacrum, the pubis, the hips on the sides, we help. And this is something, that's the other thing, right? Oh gosh, we, especially if you work in a very risk averse setting like a hospital, which I have, you don't want to go anywhere near I am
The belly.
sorry. Gotta pop that off. If you work in a risk averse setting, you don't want to touch the belly. Oh, that's a GYN or a midwife's job. So, but there is a way to address the abdominal fascia. So I tell my clients, I am not rotating baby. I'm not touching baby. I am identifying where your trigger points and where your restrictions are in your abs, because that will, and I would love to share that image. I shared it recently on my social media. Within one session, I had this pregnant mom's belly go from looking like she was 28 weeks or 30 weeks at most to like 35 weeks. Like she had so much tone in her abdomen. Her baby was so held in and baby was breech. Baby literally had no room to move. So understanding that babies' heads are bigger in circumference than their buttocks or their feet. So if someone has pelvic muscle tension, especially around the pelvic inlet, the top of the pelvis, either from the true pelvic floor or from the lower abdominals, that baby cannot get in a good position. Do what you may. Like you can go on the ironing board like multiple times a day. But if there is tension in your lower abdominals and in your pelvic inlet, that poor baby cannot spin head down. It will just be too much stress for you, too much stress for baby. So we teach pelvic health professionals how to get hands on and release that tissue in a safe way. Because again, we are not digging. Remember, that's exactly what I'm teaching. Like we are not doing this. The client and I are doing it together. She is breathing, she is causing the expansion, she is relaxing. So it's also very reassuring for mom that she's participating. For the professional, that we are not flipping baby, that is out of our scope. We are creating space in this person's lower abdomen and in their pelvis to allow baby to realign. And also, because I will always pull from Ayurveda, it is such a wonderful science. Ayurveda would say, okay, outside the physical, what's happening? How is mom feeling emotionally? What is happening energetically? And this I will see a lot. I don't know if you've noticed it clinically, Laura. Moms who have had multiple miscarriages, who have had extensive gynecological surgical histories, stillbirths, they or IVF moms, their babies will be breech a lot, because for them that sense of loss is so high that it becomes an emotional block. Like physically, their pelvis may be perfect. And of course, we will then do the outer pelvis, then we will do the tailbone and the pelvic outlet. So again, very clear system of how to go step by step. We do the pelvic inlet first, then we do the mid pelvis, we do the pelvic outlet, then we address the emotional and energetic fears that may exist. So again, for some moms, like even though like their part of their brain says, I want to shoot for a vaginal birth, I say it is like, it is okay for you to have a planned cesarean, because I can see how much fear and anxiety and trauma this is causing you. Because I'm talking about like a specific client who's like 43, like years, almost like multiple decades of infertility. And finally she has this baby, and very well read, well educated woman. And she knows it's best for baby and for her to have a vaginal birth. But because that sense of loss was so high for her, because she had been through so much, her pelvis, like physically was great, but baby would not flip. And then it was like, I am failing my baby. This is a breech baby. And,
Yeah.
so having those conversations and helping our clients feel balanced structurally in the physical body and emotionally to have the birth that feels best for them. That's what we are shooting for with the optimal fetal positioning work.
I love it. It's amazing. All
Cute.
right. So thank you again, and we'll be talking soon.
Yes, sounds wonderful. Thank you, Laura.